Attention deficit kitten! Nope, not a kitten, just my imagination. Where was I? Right! ADHD, attention deficit hyperactivity disorder, more commonly known as that brain thing that makes you go, huh? But seriously, ADHD is far more complex than that. And I would know. I was diagnosed with severe ADHD when I was 9 years old, and for the past 7 years, I've been struggling to understand what exactly that means and how to deal with it. Fortunately, according to Dr. Russell A. Barkley, a leading expert on ADHD, there are plenty of highly workable solutions available. So let's first look at the neurobiology of kittens. Then we'll move on to how kittens affect us in our everyday lives. And finally, we'll look to the future to see how we can help treat kittens and expand our knowledge of ADHD. This is about ADHD, not kittens. But to truly understand the goings-on of the ADHD mind, we must first look at the neurobiology of it. According to the Takeda ADHD Institute, ADHD is most commonly associated with some structural anomalies in the brain. These two main anomalies are neural pathway breaks and chemical release. Imagine your brain is a city. In that city, there are roads or neural pathways and cars or neurons. Now, these cars travel across these roads to deliver messages. And in the neurotypical brain, the cars can get from point A to point B with no problem. But in the ADHD brain, there are road closures, so the cars have to take the long way around. That sucks, but it's all exacerbated when you consider chemical release. The gasoline these cars need to go, because in the ADHD brain, we either don't release enough chemicals, not released at the right time, or they simply don't release at all. So in short, we're stranded without gas and the roads are closed. But while we're stranded on the mind's highway, what's happening in real life? Well, according to the Mayo Clinic, studies show that ADHD significantly raises rates of anxiety and depression, which in turn raises rates of substance abuse, homelessness, and unemployment. But what are most of us struggling with? Well, symptoms of ADHD can most commonly be separated into two categories: inattentiveness and hyperactivity. Let's talk about inattentiveness first. Most people think of this as not paying attention in class or misplacing your keys, but that's not entirely wrong. But it's not, as the name implies, that people like me have a lack of attention so much as we have an inability to maintain attention. So I can sit at my room ready to do my history homework and pet that cat. And yeah, I forgot what I came in here to do. But hyperactivity, on the other hand, shows itself in many forms. One of these forms is over-socialization, which is typically more present in females. Instead of the characteristic running circles around your peers, it's just being overly talkative. My sister struggles with this, and though it doesn't seem that harmful, her unwillingness to give anyone else a chance to talk has hurt her relationships with friends and family in the past. So now we know a little bit about ADHD, its causes and harms. What can we do to help cure ADHD? Well, lucky for us, we live in an era of medical wonder. According to the CDC, the two most common methods of treatment are medication and behavioral therapy. But that's a CDC. What can you do? Well, my advice would be to just give us patience. I can't tell you how many times I've needed to hear, "It's okay, take your time. What can I do to help?" When instead all I've got was well, you just gotta buckle down and focus. The most important thing is for people to respect how my mind works. So there you have it. You know all about the neurobiology of ADHD, how it affects us in everyday life, and how you can help. So what's the takeaway? Well, if there is one single thing I need you to take away from this, it is that, oh, there's the cat. I guess I wasn't imagining things after all.